We organized the Insight Conference to get a scientifically based conference out in the field to bridge the gap between psychedelic science and what people are really doing in psychotherapy, psychiatry, and basic research. Oh, we have a broad audience, but it's mainly focused at professionals in the medical field, psychotherapeutical field, maybe also prevention field. And for that to happen, we need to really clarify the background of what is happening in a psychedelic treatment. And to do that, we need disciplines like philosophy, of course, basic research. And that's how we try to make clear that there is a foundation in psychedelic science that is reaching from medicine, neuroscience to the humanities. I think there have been amazing conferences in the field, but some of the conferences were organized or constructed in a way that not a lot of people working in conventional psychotherapy would attend. They seem to be afraid of the stigma or of also some kinds of unprofessionalism that sometimes happen. And we're just working towards a conference or a discourse that is including civil society practice and academic knowledge, and bringing it together. Yeah, to have a conference like the Insight in English in Berlin, the capital of Germany, may seem odd to some people, but basically the research, the empirical data, the results are being produced now in countries outside of Germany, and we are, like the Germans, are craving for some empirical data right now. And it's also an international effort to bring this therapy to people who are suffering from different diseases or wrong treatments in the field of psychiatry and psychotherapy. So the Anglo-Saxon world and also all the other countries need to form a platform, and English is the best language to do that. On a typical day of Insight conference, you would get talks about medical progress in the treatment of alcoholism, depression, PTSD, and other indications for which this treatment is tested. But you would also get some background talks about conceptual matters. How can we really measure or describe what's going on in psychedelic-assisted therapies? I think you would also get a considerable amount of talk about what spiritualities and meaning-making is that seems to be part of psychedelic treatment. And how things come together. So transdisciplinarity is one of our goals. We want practitioners with different views in the background to speak about their practice, and the researchers to come in with their perspectives on the data and somehow make sense of it. And the Insight is particularly there to create a perspective for bringing this out to people who need it. In the academic world, it's very typical that people use the word interdisciplinary, but actually not a lot is happening. So people really have to work to understand the concepts and the way how people are looking at things in another discipline. We also prefer to use the word transdisciplinary because that also relates to people who have rather a practical, everyday mindset, how they relate to scientific stuff. So practice and science comes together. Interdisciplinary, transdisciplinary also needs an openness to question your own data, your own concepts. It's part actually of a full academic career to look at the paradigms that your data is relying on, because all the data in science rely on certain paradigms, and transdisciplinary conferences help to review what you've been doing and want to do in the future. Well, we're planning, in 2021, we're planning to get more traditional research institutes in. So at the moment, we are related to a number of universities in and outside of Germany, but I think that we also need to reach out to those that are not related to this kind of treatment so far, and we want to do that in 2021. Also, talking to more practitioners who would then have the possibility, maybe for the first time, to read and hear about new treatments for their patients. Berlin is a great place to have the Insight Conference in, because it's a city where cultures meet, where actually a lot of substances, mescaline, for example, has been investigated more than 100 years ago. So a lot of the processes started with German pharmacology and European pharmacology, of course, but it's a melting pot of different perspectives. It has always been, and that's why I think Berlin is the ideal place to start such a new fascinating field.